Alzheimer's Dementia by Jamie Grossberg. This PowerPoint presentation will describe the prevalence, demographics, and risk factors associated with this type of dementia. It will discuss the pathophysiology, define the clinical presentation, and describe which assessment tools nurses should utilize. Prevalence of Alzheimer's dementia. Alzheimer's dementia is the most common type of dementia. This form of dementia does not discriminate and attacks all types of people. Although this disease can occur at any age, it's mostly prevalent in those 65 and older. It's estimated that 5.4 million Americans have Alzheimer's dementia, and it is also estimated that this number will double every 20 years. Demographics and risk factors. As previously mentioned, Alzheimer's dementia does not target any particular population, sex, or ethnicity, although it is most commonly found in the older adult, with a risk for developing doubling every 5 years after age 65, and by age 85, approximately one-half of people will have symptoms of Alzheimer's. Risk factors also increase for those with first-line relatives with the disease. However, some risk factors are modifiable, such as those associated with head traumas, by avoiding contact sports, and vascular disease, such as physical inactivity, increased cholesterol, diabetes, smoking, and obesity. Pathophysiology. People with Alzheimer's dementia have the following three pathological changes occur. First, a loss of neurons in the hippocampus and the cerebral cortex. The hippocampus is located on the floor of each lateral ventricle of the brain. It is thought to be the center for emotions, memory, and the autonomic nervous system. The cerebral cortex is the outer layer of the cerebrum and plays a role in consciousness. Secondly, an accumulation of intracellular proteins, which form neurofibrillar tangles, which are markers for Alzheimer's dementia. Lastly, an accumulation of extracellular protein deposits called senile plaques occur, which are masses of decaying nerve terminals. Additionally, people with a particular form of the gene for apolipoprotein E, a cholesterol carrier protein active in the brain, are 3 to 4 times more likely to develop Alzheimer's dementia between the ages of 60 and 70 years old. Clinical presentation. Alzheimer's dementia has several clinical features and is not limited to memory loss. Diagnostic criteria require that one of the following be present. 1. Impaired ability to think abstractly, plan, organize, complete a sequence of action, and make decisions. 2. Aphasia, which refers to language deficits. 3. Apraxia, which is the inability to carry out motor skills. Or 4. Agnosia, which is the inability to recognize familiar objects. It is important to also remember that severe memory loss is not a normal part of aging. As time goes on, symptoms of Alzheimer's dementia become more evident and include denial, confabulation, which is the creation of stories instead of actual memories, perseveration, which is the repetition of phrases, and lastly, avoidance of questions. Diagnosis. When symptoms of dementia are present, a primary care provider will perform a comprehensive assessment to rule out any treatable conditions that may mimic dementia. To diagnose Alzheimer's dementia, ruling out all other pathophysiological conditions must be done. This is completed through a complete history and physical, laboratory test, and imaging. In addition to a complete physical and neurological exam, it is important to obtain both medical and psychiatric history, description of symptoms, review of medications, and nutritional evaluation. It is also important to take into consideration the observations and history provided by family members. Brain imaging, such as CT and PET scan, are also important because they reveal brain atrophy and rule out conditions such as neoplasms. Neurological tests such as the mini-mental, which scored 0 to 30, and 30 was considered normal, are no longer available. However, there are alternatives such as the mini-cog and the St. Louis University Mental Status Examination. In concluding this presentation, I hope I have provided my viewers with a better description of the prevalence, demographics, definition of the pathophysiology, and clinical presentations of Alzheimer's dementia.